Dear speakers, facilitator, and audience, good morning, good afternoon, good evening, good day, and welcome. Immunization programs face many context-related logistical, economical, and socio-cultural challenges that contribute to suboptimal coverage. Health systems sometimes struggle to effectively engage caregivers and communities, leading to weak demand and acceptance of vaccination. Vaccine hesitancy is not something new, either globally or in our region, and it's not limited only to the clients, but also to providers. According to the recent UNICEF, WHO, and Gavi Pulse survey conducted in collaboration with the US CDC, Sabin Vaccine Institute, and Johns Hopkins Bloomberg School of Public Health, 3/4 of the 82 countries respond to that survey reported COVID-related disruptions in their immunization programs as of May 2020. The reasons of disrupted services vary from a country to another one. Even when services are offered, people either unable to access them because of reluctance to leave home, transport interruptions, economic hardship, restriction of movement, or fear of being exposed to people with COVID-19. Many health workers are also unavailable because of restrictions on travel or redeployment to COVID response duties, as well as lack of protective equipment. During the last couple of months, most of the countries resumed their immunization activities, and they are exerting significant efforts to catch up. The objectives of these webinars are to shed light on the main determinants of current challenges affecting demand for immunization, to discuss appropriate strategies for regaining population trust and confidence in immunization services, to propose applicable, sustainable, and innovative solutions to maintain the improvement of healthcare workers. Let me now to introduce the speakers and the facilitators and thank them for joining us today. Our first speaker is Dr. Nito Abad. Dr. Nito is a behavioral scientist in the Global Immunization Division at the US CDC, focusing on assessing and intervening on the behavioral drivers of vaccine hesitancy globally, particularly in low and middle income countries. In addition to her work on vaccine hesitancy, she conducts implementation science research on the sexual transmission of Ebola, as well as other research. She earned her PhD and master in social psychology from the University of Missouri. Dr. Daniel Nigemera is our second speaker. Daniel is the senior immunization specialist for the UNICEF Middle East and North Africa region office. He is leading the regional immunization team since March 2018. He has more than 22 years of experience in health field with UNICEF at various capacities and countries in Tanzania, Iraq, Uganda, Sudan, South Sudan, and Myanmar. Daniel is a medical doctor and holds 2 master's degrees in international health management from Sweden and in public health from the Royal Tropical Institute in Netherlands. Our third speaker is Dr. Kamel Abusel. Dr. Kamel is the National EBI Manager in Jordan. He has a 20 years experience in field of public health in general, mainly on disease control with particular focus on EBI. He is also a member of the NITAG committee, and he holds a degree in medical science from Romania and the Arab Board of Medical Specialization in Community Medicine. Our facilitator also is Ms. Elizabeth Wilhelm. Elizabeth is a health communication specialist in the US CDC Global Immunization Division on a team of behavioral scientists to diagnose and address vaccine demand and acceptance issue, especially supporting the need of low and middle income countries. Elizabeth holds a master in communication from Johns Hopkins University. And I'm Majid Al-Junaid, the Director of Public Health Programs in IMPI. Thank you very much. Before giving the floor for our first presenter, we'll start with a poll, and that's just to ensure an interactive webinar and to ensure your participation, all our guest participants. So now you will see on the screen 5 questions. two of them related to the vaccination coverage and increase or decrease in the coverage, and the remaining three regarding rumors. And we are encouraging all of you to respond to these 5 questions based on your country experience or your regional one. So please, all of you, start answering these 5 questions. They are very short multi-choice questions. We will have maybe another around 2 to 3 minutes to have the answers. After that, our first presenter, Dr. Nito, will start her presentation, but also you can have another additional 2 or 3 minutes during the first few minutes of her presentation to finalize the poll. So please go ahead. Okay. We hope that now we are receiving answers. Are you ready or not yet?
Sure, I can begin in 1 minute or so.
Yes, the floor is yours, but you can start. But we are looking for more people. We can give them another 2 minutes because we still have only maybe 13, 15,
Sure.
20, 25. Oh, that's good. So we want maybe to reach higher number.
No problem.
Okay.
We look forward to everybody's responses.
Yes, we are highly encouraging them. Please go to this. Okay, so as we said that even they can have maybe another 2 or 3 minutes if you allow, and then we can continue, because also during the first presentation we will have some discussions on the results of the poll. So as I said, it's an interactive, and we are looking forward to your experience, to your opinions, and you just don't want to be one channel of communication from our side. So that's good.
Are people able to submit their answers? We're getting some chat that some people are getting an error message. Hopefully it's working.
Yes.
Okay. I'll go ahead and start then.
Okay.
Is that okay? Okay. And we'll keep the poll up for a few minutes in case you are still working on the poll. You can still take it.
Yes, and that's very important. That Elizabeth, thank you. Yes, we have 5 questions, so you can scroll over the screen. So ensure that you answer the 5 and then submit.
Let me see. Okay, are you able to see the slides?
Yes, that's good.
Okay, wonderful. So I will go ahead and get started. Good afternoon, everybody. My name is Dr. Nito Abad, and I am a behavioral scientist in the Global Immunization Division in US CDC, and I'm very honored to be here. So thank you for inviting me to give the global update on the impact of COVID-19 on demand for immunization and potential solutions that can be used in the MENA region. So I wanted to start today by showing you what we call the vaccination behavior continuum. And it shows what we consider to be the range of attitudes towards vaccination. On the left, you have demand for vaccination, and then you have passive acceptance and vaccination hesitancy, where some vaccines are accepted or some are delayed and some are refused. And all the way to the right, you have refuse all vaccines. We think that most people really fall in the middle of the continuum. That is that they are passively accepting some vaccines, or there may be some hesitancy. But generally speaking, there is general acceptance for vaccines. It is rare to find caregivers who are refusing all vaccines. So some examples of this type of behavior would be mothers waiting in line for vaccination, for immunization at health facilities. That would be considered demand. Maybe if there's a campaign, mothers accepting vaccination at their door, such as OPV. And refusing vaccines could be refusal of the MR vaccine or something similar. So this is a range or a continuum of behavior. It's not the case that everybody demands or everybody refuses. Generally, people are in the middle. When we think about what factors influence decisions about vaccination, we think about that at different levels. So there are some factors that are relevant at the service delivery or the point of vaccination level. That can be things like the vaccination schedule, if there are any costs associated with getting vaccinated, whether the vaccinator is seen as being a part of your community, things like that. The individual and group level factors are beliefs and attitudes about the disease and health and vaccine preventable diseases. And this is also true among caregivers and healthcare workers. Healthcare workers also have a perspective. And also the kind of experience that you might have with the service delivery and health services and how that might inform your experiences. And then there are contextual factors such as media and public communication, politics, religion, and cultural values, and trust in authorities, which is a very important factor during this pandemic, as we'll get to later. So just think about these different levels as I'm giving my presentation. We'll return to this idea. So what does it mean to have vaccine confidence or to have confidence in vaccination services? So we believe that building demand for vaccines means maintaining confidence in the health system, the vaccinator, and the vaccine. So there are three components of vaccine confidence. So now here is the reason that we're all here. What has happened to immunization as a result of the COVID-19 pandemic? And I know in the last webinar, we did talk about this extensively, but there's different surveys out there that are trying to really understand the impact on immunization and demand. So this one is the Pulse survey, the second version of the Pulse survey, which included some questions on demand. We had 281 respondents from 82 different countries, and you can see there is good EMRO representation in the results. And this was a poll by WHO and other partners. And nearly 70% reported some level of disruption to demand for vaccination services due to the COVID-19 pandemic. If we take a step back for a moment, we can look at this map and see, as reported in May of 2020, since January and February of 2020. So that means pre-pandemic to May, which is when some of the severity globally was happening with the COVID-19 pandemic. And you can see that from pre-pandemic to the pandemic starting or kind of being in progress, there have been quite a lot of disruption to immunization services globally in many different countries. The next map is from April 2020 to May 2020. So now we see what happens now that some of the restrictions have been put in place, but kind of things are progressing in terms of the pandemic. From this 1 month period, we can see that some countries are starting to see improvement in the ability to provide immunization services. So the immunization services have started up, they're kind of going again. Now, this is a map of reported disruptions to demand for vaccination services. So whether the community wants vaccination services. And you can see in May 2020 that we are still seeing quite a lot of disruption in many countries, especially in the global south, that indicates disruption to demand for vaccination services. So from this, we know that despite some improvements to service delivery, maybe services have started up again in many parts of the world, we're still seeing issues with demand. So what is it that we can consider to be the primary barriers that we're observing during the COVID-19 pandemic to disruptions to demand for immunization globally? Well, we think that we have several categories of barriers that we can understand from surveys like the Pulse survey, as well as the Gavi SITREPs and other sources of data that are coming out. The first category is caregiver and healthcare worker exposure fears. So we know that caregivers fear exposure coming to health facilities to get immunization services. And healthcare workers also are fearing exposure to coronavirus due to limited availability of PPE. And some have also indicated that they're not sure if caregivers are going to be compliant with behavioral measures or if they're going to be honest about their prior exposures. We also have the influence of COVID-19 mitigation policies. These are movement restrictions, lack of transportation, and other issues that make it difficult for caregivers to know where to seek immunization services or even if immunization services are being offered. Vaccine stockouts and limited supplies are also affecting demand. Even though these are supply side issues, they affect whether the caregiver can trust that the services are available when they arrive. So shipment delays causing a shortage of supplies and vaccine stockouts, EPI staff being diverted to other duties within the COVID-19 pandemic response and maybe not being available for immunization. And finally, this is a major factor, the intensification of rumors and misinformations about vaccination that we're seeing about currently available vaccines, and also rumors starting about the future COVID-19 vaccine. So we consider there to be too much information, which WHO calls the infodemic, or also false information, which is misinformation and rumors about vaccine safety and vaccine efficacy and many other things related to vaccination. So we're really seeing this in many countries across all income levels, being a major issue when it comes to trust in vaccines. So we can think about this categorization at the service delivery level, individual and group level, and the contextual level. Some of these barriers that I've mentioned, where do they fall? Well, you can see that the exposure concerns fall across service delivery and the individual and group level. Confusion about where services are available and when they are available, also along those two categories. And then you have things that are service delivery specific, like the stockouts and limited PPE, as well as the EPI staff diversions. And then spanning the individual and group level, as well as the contextual level, you have the influence of misinformation on public trust and belief in vaccines that can affect perspectives, as well as lockdowns and the lack of transport and some of the mitigation policies we're seeing that affect caregiver mobility in most countries. So at this point, I'd like to take a look at what this audience is saying are the primary barriers that you are facing in your country. Let's see. Atsu, are you able to share the polling results?
Yes, I'm going to do that right now.
Okay, wonderful.
That's good. I think we have 100 results from the total participants of 194. That's good, I think. Yeah. So,
that's great. That's a good number, and that's a reliable number of people. And so let's see what you've said. The first question is, how has the number of clients receiving immunization services in the facilities in your country changed since the COVID-19 pandemic began? So we're seeing a decrease a little. That matches what we see on a global level, that the decrease is not so severe as it was maybe in the spring or early summer of this year, April, May, but it still has decreased demand for vaccination services. If there has been a recent decline in demand for vaccination in your country, what is the main reason for this? And again, that first category of fears is also being reported here. The primary reason is caregivers are concerned about the risk of exposure to COVID-19 if they come for services, followed by some of the COVID-19 mitigation measures, such as limitations on public transportation, lockdowns, and physical distancing policies. and some lack of awareness about where and when COVID-19 services are available. Interestingly, this audience is saying that there are few healthcare workers who do not want to provide services. So perhaps healthcare worker issues are doing relatively okay in some of the countries. Have you personally come across rumors or misinformation about vaccines since the start of the pandemic? Yes, nearly 70% of you have seen it. And I know that here, many of us have seen it on our WhatsApp channels, on social media. It is very common to come into contact with some rumors or misinformation. How did you hear the rumors? It's a word or social media being the primary channel here, which also matches what we're hearing in many other parts of the world. Or word of mouth from family and friends and other forms of media. So social media seems to be the primary channel that these kind of rumors are disseminated. And what was the rumor about? So here we have an equal split between politics or mistrust in services, as well as alternative COVID-19 treatment or cure claims, followed by whether or not vaccines are safe or do they work, and whether vaccines are even available. So this is also a common trend for there to be rumors and misinformation on social media about mistrust in services and about the COVID-19 pandemic itself. So that's very interesting, and hopefully we can return to some of these issues during the Q&A, and you can kind of share your experiences with what you're hearing. So if we return to the presentation, now that we've talked about some of the primary barriers, both globally and now for this audience in this webinar, we can go to the next question, which is, okay, now that we know these barriers exist, what are promising interventions that can help reduce the negative impact of this pandemic on global demand for vaccines? And this is not an exhaustive list. There are many innovations and many interventions that can be tried. But these are some techniques that we think may help immunization programs raise demand for vaccination. One is improving communication between healthcare workers and caregivers about vaccination. And there is a tool out there called motivational interviewing, which is a conversational tool that encourages reflective, open, honest, respectful conversations between healthcare workers and patients or clients. It has been used for behavior change in many different areas of public health, like decreasing obesity, smoking cessation, risk behavior reduction, things like that. And we think that by using motivational interviewing to improve interpersonal communication, MI could potentially improve immunization uptake, reduce vaccine hesitancy, and improve defaulter rates or reduce the number of defaulters or people who delay vaccination. Well, how does this work? So motivational interviewing encourages healthcare workers to ask open-ended questions in their conversations with caregivers. It's the use of the words what, why, how, tell me, to validate the questions that they're hearing from caregivers and explore reasons behind hesitancy. So instead of closed-ended questions, like where the answer is yes or no, you encourage open-ended questions like, what do you think? Or what did you understand of what I said? An example is a patient says, I know vaccinating may help me, but I am afraid of side effects. And a response could be, I understand that you want to make the best choice to keep you and your family healthy. What side effects are you concerned about? Is there a part of the vaccination process I can explain? So it really encourages this open dialogue between healthcare workers and caregivers, where a caregiver may be able to mention a rumor or piece of misinformation they've heard, and a healthcare worker may be able to respond to it. Another series of techniques are really strengthening community engagement. And this is an example from Afghanistan that we discovered, where they're really mobilizing different aspects of society to help with the added burden of COVID-19, the influence on immunization. So we have religious leaders making sure that they're disseminating current messages about vaccination and also COVID-19 mitigation measures. Community-based outreach vaccinators to raise awareness about the disease and reinforce prevention measures. Getting a real network of volunteers together some 60,000 people who are trained in different aspects of VPD surveillance and who also are participating in the COVID-19 pandemic response. And having a strong national centralized response here. So having a national help team that can help carry out the emergency response plan. So now we can return to this idea of how do we manage the infodemic, or what do we do about misinformation and rumors? And this is an area of science and sort of research that's just now, getting off the ground. There have been people who have been doing this, but now there is global concern about this issue. And so there are different techniques and tools and interventions that are recommended for, say, health authorities. That can include message alignment, so making sure that your messages about the COVID-19 pandemic and immunization are aligned with national policy and that they reference credible sources and are disseminated in a timely manner so that when the community needs them, they have them. Social listening is a very important tool that has been really useful for health authorities to understand what the community is saying. And when misinformation is observed in a community, having a channel to report it. Explaining why guidance is changing. We saw this throughout the pandemic, and we still see it, that guidance changes quickly. Explaining why that guidance is changing is important to developing public trust. And all of these things can maintain public trust in addition to regular communication. So frequent communication, not just when a crisis occurs. Similarly, for frontline health workers, they need to be equipped with messages and job aids, and these need to be up to date and current. When encountering misinformation, the guidance is listen with empathy, address the misinformation, explain why it is inaccurate, and help fill the information void. Ensure that your IEC materials are up to date, those that are displayed in health facilities and in the communities, and also maintain the trust by really addressing the concerns that are within your control or that you can address. Don't just sort of ignore the caregiver concerns or move past it, but really try to focus on what they are. This is an example of an intervention and kind of an innovation in this space that has been done in Algeria. Algeria had set up a hotline in their capital to boost early detection and also help contain the spread of the disease by promoting mitigation measures. Volunteer doctors in Algeria answered questions from citizens within Algeria about COVID-19 and related issues. And just within 10 days of this hotline being established, nearly 46,000 people called this hotline. So that indicates a really quite high demand. The volunteers provided callers with information about the COVID-19 pandemic and directed cases to medical centers, but then also answered a variety of questions that people might have about the pandemic and associated issues. So this is a quote from one of the doctors who answered calls on the hotline. Most callers are housewives. They are worried and want to know how to protect their families. Some women called to find out if drinking herbal tea or medicinal plants can prevent coronavirus. Others wonder whether simply wearing a mask is a guarantee they won't get infected. So you can see in the early days, especially, a lot of questions about mitigation measures, prevention measures, etc. You can see how a hotline like this might be helpful for addressing misinformation and rumors about vaccination as well. So the WHO has recommended that countries set up call centers or hotlines such as this to provide information, advice, and counseling services to concerned citizens. So these are some of the key takeaways from the global update, which include an overview of the primary barriers or demand challenges to immunization systems globally since the onset of the COVID-19 pandemic. That can be caregiver and healthcare worker exposure fears to the coronavirus, which causes COVID-19. Difficulty knowing where services are available, when they're available, and how caregivers can reach them given the mitigation policies. And the influence of rumors and misinformation on public trust. Some of the interventions that we've discussed, which is not the full list, but are some of the techniques that we are thinking could be helpful, are strengthening your existing community engagement techniques or finding ways to reach communities that maybe you haven't reached, but that still have concerns about COVID-19 and immunization. Increasing healthcare worker capacity to communicate with caregivers about vaccination. And we are also considering the important channel of caregivers to communicating with other caregivers. How can we improve that as well? And also, how can systems, health systems, governments, et cetera, respond to vaccine misinformation and increase public trust? This last point is very critical as we think about when a COVID-19 vaccine may become available, making sure we understand how to increase and facilitate public trust in it. So that's the global update. Thank you for listening. And I can be reached at this email address if there's any further questions. And I'd like to thank Atsu Ishizumi for help preparing the slides, as well as GHD for the polling logistics and overall logistics. Thank you.
Thank you, Neetu. So we were hoping to take a few questions from the audience, but I understand we only have 4 FAQs and we're running a little bit behind. So the suggestion was to encourage colleagues to continue submitting Q&As, and then we'll rope in answering questions directed to you in the next set of discussions, if that makes sense. So I'll turn this back over to the chair. Oh, Dr. Majid, you're on mute.
Thank you very much. So now we'll go to the second presentation, and that's good choice that we will have the questions after the third presentation. So we are looking for more and more questions. There is already some few started, but we are looking for more participation. And thank you very much for the very rich presentation, which will definitely trigger more and more discussion. We'll go now for regional perspective for Daniel. Daniel, the floor is yours. Please go ahead.
Yeah, thank you very much, Dr. Majid, and I'm happy to be here. I hope you are all able to hear me. I would like to share my presentation. This one will be a brief presentation, is bringing in more of our region, because as I think at the introduction, my name is Daniel Ngemera. I'm the Senior Immunization Specialist with the UNICEF Regional Office based there in Amman, Jordan. And I will be taking you through what we have seen so far, and I think also remind us back from the what we have been seeing in terms of the trend in the coverage. I think that will be really important as a reminder that despite the fact even pre-COVID we were already stretched with the challenges. As a region in UNICEF, we are committed to support basic health care and immunization needs in the worst affected countries, and doing so in a way that will limit the risk of COVID-19 transmission. This was a statement I just take it from our regional, our executive director. Our major concern is mainly on the countries in the region that are battling the vaccine preventable disease outbreak while responding to COVID-19 cases. Because as I think we have heard from the first presenter that during the previous month, I think most of the attention and all of the shift has been moved to COVID. That is understood. But at the same time, we have to understand that the other vaccine preventable diseases were not didn't go on sleep. They were also circulating in our communities. And I think as we understand that in our region, some other countries our system are already stretched, and which could lead to more additional loss of lives and suffering. These countries can either face additional outbreak of vaccine preventable disease. We have already seen, I think you will be hearing more news about also issues related to CBDPV, measles, and all of that. Here, I would like to just taken from the UNICEF WHO estimates from the annual joint reporting forms. And you know, I think a month ago we had a new release of 2019 coverage estimates, and you could see that there has been a trend in changes. Like there are countries which have consistently been performing poor in the, for example, I'm taking an example of measles, the first dose. You could see most of the countries which are already stretched, like Syria, Yemen, and now I think if we look at a country like Libya, it shows that in 2019 there has been a decline. I think this was like the the estimate have been adjusted. So that is like also another one, like a wake-up call that the business is not over, and then there is a lot to be done. And I think as countries continue to struggle with the current COVID pandemic, so 2020 measles coverage will lose more grounds, and we need all to be aware of that. And in addition to the existing challenges. And this again is the measles second dose. You could see clearly that Yemen is consistently has been performing very at low, and then also followed by other countries. Like you can see even other countries which we are performing well, like Sudan now, it has gone down. And definitely this is already another reminder all of us that there is unfinished business, which was also existing before COVID. Now with this more complication, if more attention is not really paid to what was a already existing problem, then we may be facing a lot of challenges. So as we are battling COVID, we keep on reminding that to make any necessary means possible to quickly resume the immunization services. And at the same time, we are taking all precautionary measures to make sure that communities, caregivers, and children will be protected against COVID as well. So I think this is another point, like the vaccination campaign were postponed to ensure that the delivery of immunization services does not contribute to COVID-19 spread and to follow recommendations of physical distancing. This one, I will take you briefly on what we did, a rough estimate showing that in polio campaigns, we are targeting around 10 million plus measles of any sort, whether it was a catch-up dose, whatever. It was almost ranging to nearly 15 million. If you take last year alone, around 34 million children were vaccinated against measles and polio. Especially for measles, a lot was done. Like in last year alone, in Yemen and the Sudan, nearly more than 20 million children were vaccinated against measles. And I think we're looking at all the reasons why there has been all of this, the decline in the services. I think I will not go into the details because the previous speakers has mentioned, because as we are looking at the demand for services and also access to services, and which we were trying to map out what exactly could has contributed. And then another area which is still more important is like lack of supplies in PHC facilities in some countries and the shortage of personal protective equipment in facilities for community outreach. What we did in our case, we found that vaccine actually, for example, in immunization per se, vaccine was not an issue. We didn't have any major issues with the vaccine. In other countries, they faced challenges with having vaccines delivery because of the cancellation of commercial flights, because most of vaccines are shipped by commercial flights. So mainly was the issues of fear of contagion, and also the demand for the services as well, and also compounded with the lockdown and the movement restrictions. But all in all, I think the demand part is still critical, and there is a lot which needs to be done. And this is one of the slides which I would like to show you, which we get from one of the countries, indicating clearly that comparison between the same period of 2020 and 2019, you could see clearly that in other cases there was a point decline of around 10, about like 10 to 14% in most of the antigens, and you could see in some cases even the implementation of the fixed sites were far less, and the most affected was also the implementation of outreach services and mobile services. And this is also another country which shows about, is also almost conveying the same message that I think during March and up to May, we could see a sharp decline. Now we have seen some kind of upward trends, but there are still a lot of challenges to pick up to reach the same, exactly the same levels as of 2019. So definitely it will take some time to make sure that to be able to reach the same levels of as was in the previous years. This, I think, as you all know, that we at a regional office, our role was to make sure that we support countries with the available guidelines. Like, you know, there are several guidelines which were issued out. And for example, from the first one was in March, looking at the polio eradication program, and then on how to deliver the services. Most important thing was like, how do we make sure that these guidelines are interpreted and adopted into the country context, country-specific context. And then things were evolving because some countries, they were adopting them before reporting more cases. Now things are changing. We are much more concerned, for example, in places like Yemen and in northwest Syria, those are the areas which reported the cases a bit late. And then they were planning also for resumption of the services. Now I think things have changed completely, but still there is a lot to be done to make sure that the services are resumed. And in the efforts made, you can see what I have indicated in the green color, showing that despite all the challenges, countries have picked up. Like recently in June, our colleagues in Syria, they supported the multi-antigen campaign as a catch-up immunization week, where they reached more than 200,000 children. In Yemen, despite all the challenges, more than 1 million children vaccinated with the for diphtheria, and then also polio campaign. In addition, 1 million children, and they are still ongoing with that. So we try to look at what would be the contributing all the success factors. One was the continued availability of the vaccines, and that is a reason why, like, to be able to rule out whether there is a supply or demand issues, you need to make sure that vaccines are available throughout. And that was one of the good success factors. When we did a mapping in early March and April, we realized that there was no any country in our region which had any issues to do with the vaccine. And number two is provision of the PPEs and the capacity building of health workers and the social mobilizers on infection prevention and control, and how to communicate effectively with the caregivers, and the high level advocacy with relevant authorities, especially the Ministry of Health and other related advocates, because that was really critical. Given the high attention of COVID-19 response, it was highly unlikely that you can go out and convince, you needed to use, to advocate with the ministries at all levels, being at the governorate or at central level, to make sure that they understand and also they allow, or they're in agreement that we need really to ensure continuity of the immunization services. And I think the other key area was like what we realized in other countries was the continued media engagement and the monitoring of rumors at all levels, because that was also critical, and amendment of the key messages and the IC materials to suit the current context. Those were the key success factors which we have seen so far, but there is a lot to learn from the current situation. And I think one of the messages which I would like to convey here is that even before COVID-19, countries experienced parental reluctance to vaccinate their children. And this is a reminder that we already have unfinished agenda pre-COVID with regard to demand for immunization. And I think that was critical. I think if I take you in the next slide, this was this, if you recall, those who have seen the joint reporting forms, we always, in every year, we take a stock of the reasons for hesitance for accepting the vaccine. You could see one was mainly related to vaccine safety. There is one on misinformation, beliefs, and access, and also the knowledge gap. So you could see clearly that we already have a lot to address even before COVID in relation to the why there is hesitancy into immunization or demand for immunization services. And as we are planning also to resume services or to accelerate and have recovery and catch-up plans to address the impact of COVID, we have also to take into consideration all of these issues which were there before even COVID. So in conclusion, we must not allow all our efforts. We make sure that whatever we are doing, wherever we are fighting COVID, but we need to take into consideration that there must be a need to continue with delivering services. Efforts should be done to plan for resumption of services, implement the postponed campaign, including recovery and catch-up plans, and then ensure continuity of these services, and demand intervention which takes into consideration impact of COVID-19 and concerns of communities, caregivers, healthcare providers, and decision makers. This is really critical. We have seen in other countries with those convincing the authorities, especially in areas where we have postponed the campaign. It will be very, very difficult to, unless there is a very active outbreak, but in area where the preventive campaigns have been postponed and they are battling COVID, definitely you need to really work hard to have very strong evidence of convincing the authorities that services must continue while we are also addressing COVID. The documentation of lessons learned from countries which have already implemented campaigns and resumed the routine immunization definitely is really critical. It's really very important. And also, lastly, the need for stronger coordination and collaboration among partners at especially regional level and country level is really critical. Without that, it will be very difficult, and we would like to thank Infinite, I think, for taking that initiative. I think that is one step ahead, that to ensure that we at regional, global, and country level, we can come together and have one's voice while we are addressing the impact of COVID immunization, and more importantly, to ensure that caregivers and all those concerned will be able to demand for the services, and hope that the levels will be back to pre-COVID situation or even more than that. Thank you very much, and I would be happy to take any questions, and I will provide also my email. You can reach me out at any time. Thank you very much.
Thank you very much, Daniel, for this presentation and this overview, which I think shed the light on ongoing initiatives and on the current situation, and the improvement also on the progress that achieved so far, because also we need to be more and more optimistic despite the difficult situation in our region, taking into consideration, as you said, that some of the countries are facing multi-factors. So in addition to the VBDs, the COVID, and also the weak situation, weak health systems, all these needs to be taken into consideration. There is a bunch of key messages that we will discuss it also at the end of the presentation. And I'll do the same like Elizabeth, that we'll also go to the third presentation, and then we'll have an overall general discussion. We have some questions already there. I'm still encouraging colleagues everywhere, please share your questions in the Q&A, and also some of the questions on the chat, if you can also use the Q&A. Thank you very much. And we'll go now to the third presentation by Dr. Kamel Abusel. Dr. Kamel will present for us a country experience. So as we said, that we start to look for the issue at a global level, and then we have the regional experience, and now we'll go to country level, and we are taking Jordan as one of the examples of the countries where there was a very strict lockdown and also a very strong immunization program since years. So I want to learn also from different experiences and from different countries. Dr. Kamel, the floor is yours.
Doctor, if you're speaking, I don't think we can hear you.
Good evening, everyone. My presentation about Jordan response to COVID-19 and challenges on demand for immunization. Jordan has a population of around 10 million. The under one population is around 286,000. Jordan routine immunization has been mandatory since 1979. Started with 5 antigens, polio, DBT, BCG. Now in 2020, we provide 12 antigens. Last one in this July, we introduced hepatitis A. All vaccines are provided free of charge for all target population, including refugees, regardless of their nationality. The program has so far 100% financed by the government. Less than 10% of vaccines are given at private sector. This is our national immunization program, started at the first month with BCG, primary doses at 2, 3, and 4 months with Hexa and rotavirus. Then we have 2 MMR at 1 month and at 12 months and 18 months. This is our national program. Immunization before COVID-19, routine immunization services are delivered through a mixed strategy, fixed sites, and outreach teams for remote areas and high-risk groups. Strong supply chain with no vaccine shortages have been reported for at least 10 years. Population trust with high demand on vaccination contributed to success of immunization program in Jordan. Vaccine coverage is around 92% for all vaccines over the last decade, and the high coverage rate is reflected in decrease of mortality and morbidity of vaccine preventable diseases. Jordan has been polio-free since 1992. Also, discrepancies in coverage may be related to the presence of high-risk population, including refugees in Jordan hosting. High-risk groups in Jordan. Jordan is hosting Syrian refugees as well as immigrants from Pakistan, from Iraq, from Yemen, from Libya, from all surrounded countries which represented the crisis, which have the crisis, who move across these groups, move across different areas in the country, working mainly in agricultural industry. A few nomadic tribes such as Bedouins and Gypsies, who are also considered to be high risk. Hosting refugees leads to unexpected events and outbreaks of measles and hepatitis A. Last outbreak of measles was in late of 2013 and 14. It was among Syrian refugees. This sheet shows the number of refugees in Jordan. Non-Jordanian represent about 1/3 of our population from many countries, but Syrian refugees represent about 1.1 million, 0.3, and they are about only 20% of them inside camps, and 80% they are in hosting the community. In response to COVID-19 pandemic, the government of Jordan established and implemented strong legal framework to mitigate the transmission inside the country. The government took a decision of curfew and lockdown all over the country from 15 March until 25 April. In Jordan, the cumulative number of confirmed COVID-19 cases until yesterday, 10 August is about 1,252 cases with 11 mortality, and the number of PCR tests more than 600,000 until now. The lockdown and restriction of movement resulted in health services disruption, including immunization and decrease in immunization coverage. Vaccination coverage varied from 55% to 80% with difference by geographical location. COVID-19 also has a marked decrease in AFB surveillance indicators. We have the underreported with AFB and also with suspected measles. Nice. This graph shows the impact of COVID-19 this for Hexa 1, Hexa 2, Hexa 3 from for the 2 quarters, quarter 1 and quarter 2, in comparison with 2019 and 20. And from around 90%, the ratio, the coverage of vaccines decline and decrease. It is around 70 to 74. It is due to COVID-19, and this it shows the coverage according to from the first 6 months this year, from January to June. If you look to in March, April, May, it represents a high decline in the coverage, which represents the crisis of COVID-19. Immunization response to mitigate COVID-19 pandemic and promote trust and increase demand. Jordan started to resume healthcare services, including primary healthcare, on April 26, when health centers was open to provide vaccines only. In addition to activation of a mobile outreach program to improve coverage in hard-to-reach refugee children. The response measures taken by the government was like entry screening and quarantine measures, promote the trust of health system, including immunization, and also increase number of vaccination points in health centers. Strategies and priority. Social mobilization plan, developing and distribution message through social media and mobile teams on importance of vaccination through daily message by Health Education Directorate. Infection control measures must be taken during vaccination, like mask use, hand hygiene, physical distance, and also provide the facilities with adequate infection preventive control equipment, utilization of health facility visits to decrease the missed opportunity of vaccination. Strategies and priority. The introduction of hepatitis A, it was introduced in this last July 2020. The introduction was utilized to improve the vaccination coverage rates after COVID-19 through lectures, awareness campaigns, and training were used to ensure all stakeholders and informed and involved in overcoming the previous decrease in coverage rates. Due to that, we could see an increase in the coverage rates in June 2020, which may show that parents' fear are overcome and people are starting to visit healthcare facilities. And we hope also in July to be more better. Strategies and other priority. Update the national strategy for hard-to-reach pockets and vulnerable groups. A temporary support from UNICEF to enable strengthening and expanding routine immunization to refugees in host communities and provide missing vaccine for the targeted groups. Conduct a staff training focusing on identifying underserved population, including refugees, and revising respective vaccination micro plans to implement the reach every community strategy. Sustain the vaccine management achievement regarding cold chain. Main challenges and problems. Jordan hosts the second largest ratio of refugees to citizens of any country of the world in host community. It is about 1/3 of our population. Some communities are reluctant to come to public health, fear of visiting health facilities, fear of getting infection, security reasons, maybe and sometimes regarding to transportation because of the lockdown or partially locking down in the country, Syrian children at severe risk of being immunized, lack of resources, mainly financial resources. Missed opportunity vaccination in Jordan. It was estimated around 34%. Vaccine hesitancy in Jordan need to be assessed. COVID-19 crisis has a negative impact on economical situation. Population are stressed and prioritize actions other than vaccinating their children. Thank you very much.
Okay, thank you very much, Dr. Kamel, for your presentation, which shed the light also on the situation in Jordan and the current initiative, and also the stability of the immunization program in the country, and also to show the diversity of also in our region. Our region is with different countries at different level of economic status, at different level of incomes, and also regarding the immunization programs. Elizabeth, please go ahead.
Okay, so are we now doing the Q&A component?
I think so, yes. It's time now to go to the questions to select. I see some of the questions have been already selected by some of our speakers, of our panelists, so we can start with them, and then you can go and select. I'm also doing something like that. Please go ahead.
That sounds great. So if you have not yet submitted a question and you would like to submit a question, you will find a button that says Q&A in the bottom of your Zoom screen, and you can click that and you can submit a question. So if you have not yet, please go ahead and submit a question. Meanwhile, Dr. Neetu Abad, would you like to take a few of these questions? And I know there are also several questions for Dr. Bend as well, but maybe just to start off with one or two with you.
Sure, absolutely. I think there are some excellent questions in here. And this first one, I think there are several other questions from other people that I think get at the same issue. And this is, what is your perspective in terms of successfully integrating strategies to ensure increased community engagement and involvement in supportive catch-up activities to increase demand and advocate for vaccination once immunization services are resumed? How can health workers integrate those strategies? So the reason I like this question is because it acknowledges that there are going to be many things we have to do at the same time. What's happened as a result of the COVID-19 pandemic is historic, and we've never faced this many disruptions at the same time, and this many barriers. So that means that we have to think creatively at how can we get these community leaders, how can we do our community engagement strategies in a way that we're not doing it for catch up one day, we're not doing it for COVID the next day, we're not doing, that we're just not taking their time so many times for different activities. We have to think about how can we leverage this pandemic to talk about holistically the need for community engagement, the need to prepare communities for the COVID-19 vaccine, the need to promote good, timely, accurate information ahead of a particular service. So we need to think about how can we do our work efficiently with the same communities that are going to need all of these different pieces of information on different things. And health workers as well. They're a very, very important part of this whole puzzle. And then another question that gets at this a little bit too is that, would you agree that in order to have these interventions with public audiences, that huge capacity building efforts are to be planned and executed with healthcare providers? Beyond giving the healthcare providers messages information, what if they are not convinced themselves of the vaccine? How should this be measured and mitigated? When we talk about interpersonal communication interventions, for instance, with motivational interviewing, you can do interpersonal communication interventions within the context of other trainings. So it doesn't necessarily need to be that you have full dedicated multiple day trainings just on communication, although that is very helpful in many situations if you have the resources. But you can also incorporate motivational interviewing techniques or other communication techniques in every technical training that you have, so that if you are talking about how can health workers provide a particular service, or what is a technical training that's available, you can also put effort into making health workers, increasing their capacity to communicate with caregivers at the same time. Now, there are training modules out there on communication itself, and where there are resources and ability, I think that that's a very worthy endeavor to make sure that the skills are being taught well. But you can also address this in the context of other activities. And I think there was just one other question here. Just a second. Elizabeth, why don't we go to somebody else to answer a question?
Okay, Dr. Ben, I don't know if you had a chance to take a look at the Q&A panel, if you have access, as well as our colleague.
So you are referring to me? Yes.
Yeah. Oh, sorry, Dr. Danny. I'm so sorry.
Yeah. Okay.
Yeah,
I saw one question. One was about what do you think? I think it was from Samar. What do you think are the long-term effect of COVID-19 on the acceptance of vaccine and on the demand generation? Do you consider COVID-19 to have a positive impact on the uptake of vaccines? I think, yeah, I said this is really, we are seeing regarding the long-term impact, because what we are seeing, I think also from the presentation made by Jordan, you could see that in the March and the April, I think it was a sharp decline in most of the country because it was a total lockdown. No one could understand exactly what was happening. And as gradually countries are opening up and the services are being opened, we are seeing a slight increase in the services. I think even Jordan have mentioned that. So for me, I believe that what's really important here is to make sure that there is a vigorous monitoring of the situation, tracking the progress, monitor any rumors in the communities and everywhere to make sure that the communities and the caregivers are assured of the safety that the health centers and any immunization service delivery points are safer places to go, and there will be minimal chances of contracting COVID-19. And I think that is possible through guaranteed provision of PPEs and adhering to all the IPC principles, the infection and prevention measures. I think in doing that, everybody will be assured. I think from Jordan's presentation, you have seen that it seemed that the confidence in going to the facilities is increasing, and definitely we are going to see more and more increase the service uptake. And I think what will be really important is for the continued engagement, amend the messages, the key messages on immunization to make sure that they suit the current context, and because it has to be an integral part of the COVID response. In doing that, actually, we are going to see more and more maybe increase in the uptake of services. But also going back to my presentation, I have said that issues of acceptance and reluctance to vaccinate, these issues were there even before COVID. So, but maybe COVID is helping us to reveal more problems which were there and were not being adequately addressed. So at this point in time, I cannot predict and say that we are going to see a very long-term impact, but there must be, it's more likely that there could be some kind of mutual benefit because of the interventions to address COVID, and at the same time our active engagement, especially now when we are start seeing that there is a resurgence also of other vaccine preventable diseases. I think that's one of the what I can respond. And there was another question was asking about some poor countries in our region still depend on foreign funding from donors for some vaccines and how this affected during the COVID-19 crisis. If I take I think for us, we have different categories of countries. Number one, we have the upper middle income, higher income countries and the upper middle income countries, which do not, I think some are donor countries like most of the Gulf countries. And then we have lower middle income countries, like I think a country like Egypt. And then we have the upper middle income country, which is the majority, I think like countries like Lebanon and the others like Iraq. So all of that, I think, and then we have another category of countries which are lower income countries, which is more of Gavi eligible countries. Actually, for me, from my current experience, we are much more safer in Gavi eligible country. We have not seen any challenge. I think all you can mention that in June, Gavi, they had a pledge to replenish their envelope, where the initial estimate was 7.4 billion, and then they surpassed that that pledge. They went up to almost 80.8 billion US dollars as a pledge. So we are seeing that what will be required in some of these countries to come out with very strong, comprehensive plans on how to address the impact of COVID. Our concern will be mainly in other countries which are not Gavi eligible, but they are still struggling with the economies. I think we have countries like, for example, Lebanon, with all the current situation, starting from last year, adding the impact of COVID, and adding with the current problem which we have seen last week. Those, I think, are the countries which we needed to keep a closer eyes and see what we can do. But in the Gavi countries, we are much more confident that things will work out better. These are the few questions which I selected quickly, but in case there is any other which maybe someone can alert me, and then I'll be happy to respond.
Thank you so much, Dr. Daniel. And maybe to follow up on that, I think there are a few questions here related to measles and to polio, and in the context that many of these SIAs have either been delayed or canceled, or we are seeing increasing immunity gaps among children in certain countries, which means that outbreaks are likely. What perspectives can you offer in terms of the growing need potentially to do multiple campaigns very quickly for multiple antigens, and your thoughts on how to address that challenge in context of COVID-19?
Yeah, I think so very much. I think this is really critical. I think, as you saw in my previous slide, and I think this was right at early from the beginning of the pandemic, with our executive director, where she pointed out that, okay, we know that we are all concerned of COVID, but it should not be at the expense of other interventions, especially immunization. And as of today, actually, our executive director, she has prioritized the immunization as one of the flagship programs to be addressed, I think, as one of the impacted programs with COVID. And I think with measles, we have seen a challenge in the decline in the reporting cases, in the report of cases. So someone may think that maybe the cases have declined, but definitely I think the impact on surveillance is enormous, and we all need to be aware of that. We are seeing numbers coming up, and this definitely that will be vigilant. And then countries which had planned for preventive campaign, they had postponed. But we are seeing, I think from my last slide in the presentation, it was obvious that we have seen countries like Syria, with all the challenges, they have gone ahead, they implemented a multi-antigen campaign, which, for example, in every year, they do it during the immunization week in April, May, as a catch-up strategy. Now they went ahead, they did it in June. And I think the message here was, what we need is convincing the authority, the government at all levels, at the ministry level, even at higher level than the ministry. If they are all convinced, and then reaching out to communities, that will be the key success factors. Without that, it's more likely that it will be very challenging to convince the authority to go ahead and implement the campaigns, because most of the attention are still with the COVID response. And I think also with the polio, we have seen challenges now in Yemen and Sudan, where even CVDPV cases are being reported. And some of the complications have been there before, even before COVID. And what we realized that, because there were already planned campaigns before, preventive campaign, I think from my other, I think was the second or third slide, where I showed that these campaigns were scheduled in early February, May, March, and April, but they were all postponed. And in other cases, there was a lot of discussions convincing the authority that we need to go ahead and implement these campaigns. some areas they were able, like as I showed in Yemen, the campaign was already implemented, but in some other areas there was still a lot of negotiations. But now with this outbreak, actually the authority themselves are the ones pushing a lot to UNICEF and WHO that they want the campaign to be implemented even by yesterday. So I think what's really important, the key message for us is using the available evidence in case the surveillance performance is very poor, and then there are increased number of VDPV being reported. We have to use these numbers to convince the authorities that if anything is not done right now, actually we are going to see the worst than ever before. So I think the message is use the surveillance data, convince the authority looking at the numbers which are accumulating, and then try our level best to make sure that we start the plans as early as possible. That's it from my side now.
Thank you very much for these answers. And I have also a question here to Dr. Kamel. It's regarding that it's interesting that taking into consideration the integration, the collaboration that we are speaking about, did you integrate any vaccination promotion messages or materials during the COVID awareness messages? It's an opportunity. So did you utilize any of these opportunities for immunization to compensate the lockdown period, for example?
Thank you, Dr. Majid. Yes, after during this COVID, we use many tools to increase awareness among healthcare workers and also among the population by social media and TV. For example, at the Jordanian TV, I went here for interview for 2 times, and also many of responsible persons at Ministry of Health also they talks about the importance of vaccination and to increase this the awareness among our population. But there is one point I want to add about the COVID. In Jordan, I think it depends to the epidemiological situation of the COVID-19 in Jordan. When the situation is calm and we haven't any endemic cases, we see that there's a good turnout to health centers and for the vaccine. And inverse. That's like this week when we have some endemic cases, we are the population are fearing of getting the infection from health centers, and also our health staff are stressed more because of this situation.
Thank you very much for this answer. And also there is another question here about, do you have any contingency plan for immunization, either during the COVID or expecting a second wave or whatever the situation? And what are the main areas or components that you are focusing on for the coming period in Jordan?
Mainly, we observe that there is a drop in the vaccination coverage at all over the population, and mainly at high risk groups, especially refugees. For example, among the Syrian refugees, more than 50% we have a decline on the percentage coverage among them. Now, I want to thank UNICEF for their support for our mobile teams for outreach teams to reach these high risk groups. They support us for about 3 months with the vehicles, and we insist our all governorates to follow all our children and to activate the mobile teams to reach all high risk groups, including refugees, Bedouin, gypsies, and the other part by increasing the awareness and for caregivers and healthcare providers about the importance of vaccines. At the end, I think at the end of COVID, we will really analyze the situation, and we will think really about if we can if we can do a campaign for high risk national or subnational campaigns regarding the polio and measles. But now during the COVID crisis, I think it is difficult to implement like this campaigns.
Dr. Majid, I think you're on mute. Okay.
Yes, yes.
Go ahead, Liz.
Oh, yeah, thank you so much for that, Dr. Kamel, and those reflections. And I think talking about routine immunizations, everything is colored by the COVID-19 pandemic, but maybe to turn to several burning questions that were submitted related to COVID-19 vaccine in terms of safety issues, equity issues, demand issues, and some of the challenges that might accompany a COVID-19 vaccine introduction. I was going to ask if of all three of our panelists could potentially reflect on what are some of the challenges that you foresee and maybe some of the potential solutions for COVID-19 vaccine introduction in the middle of this pandemic, and just your reflections on the demand issues, especially that will impact people's acceptance for this vaccine or vaccines. How about we start with Dr. Neetu?
Thank you, Liz. And I wanted to point to a comment here that came in that I think is very valuable for us to think about as we're waiting on the vaccine. So it says, while everybody is waiting on the COVID-19 vaccine, this should give a strong push to the value of vaccines in general and should enhance demand. But yet we do not find at this point real investment of this concept to further advertise vaccines and enhance demand. And I think that's a very important point. We are at a very historic point where there's going to be a lot of interest and hopefully demand for this COVID-19 vaccine or vaccines whenever they become available. Hopefully they do become available. And that is an opportunity to not only give communities, enhanced demand for that vaccine, but for the value of vaccines in general. And in order to do that, we must start planning now. That means thinking about what your message frameworks could be. We don't know the vaccine, we don't know the content necessarily yet, but we do know that we're going to be needing to reach all the communities that are served by the EPI system. So what are some planning that you can do when we eventually are able to promote this particular vaccine? How can we reach those communities? And then the previous question about healthcare workers are going to be a major target audience for the vaccine, to take the vaccine themselves. And if you look at the way that, say, the Ebola vaccine, that introduction happened, there was resistance from healthcare workers in some areas to the vaccine itself. They wanted to know about the safety. They wanted to know about the efficacy. They wanted to have information. So it's up to us to provide that information in a timely manner as the testing is going on, as we're learning different things about the vaccine. What can we tell healthcare workers so that they are equipped and able to answer questions from caregivers? So those are some of the ideas, and also leveraging the relationships we have with communities and building new ones where those don't exist yet, to make sure when the vaccine, we have it, that we're able to communicate different things about it. Can you take the COVID-19 vaccine and the influenza vaccine at the same time? The answer is likely going to be yes. So how do we make sure that communities and healthcare workers have that kind of information? And I will refer back to Liz if she'd like to add anything, especially on the infodemic side of things.
I was just reading a news article this morning that a publication came out that said 82% of all content related to COVID-19 in the first few months of the outbreak and then the pandemic online was either false or some kind of rumor. 82% of content, which is a huge amount. And so this is going to be the first vaccine introduction at a time where everyone has a phone and many people are connected to the internet. And of course, there still are communities that are not connected. And we need to take their information needs into account because they tend to be the most vulnerable and at risk and least connected to health services. And maybe that might be a nice linking thought to bring Dr. Daniel in. Dr. Daniel, from your perspective, what are some of the things that we need to consider when we're trying to think about priority populations and who would be first in line to receive this vaccine and to ensure high demand for this vaccine and to address those concerns and address the misinformation effectively?
Yeah, thanks a lot. I think maybe I will take you back because currently, maybe I think most of the government counterpart may understand that there has been already a lot of initiative initiated by both Gavi, WHO, and the CEPI. I think they are the ones who are looking at more of I think this of the initiative is more on therapeutics, diagnostic, and the vaccines for COVID. And I think there is a lot of work which is ongoing now to look into all these various elements. I think the different working groups have been formed. I think the point you raised, because one of the recommendations being provided that the priority should be given to like 20% in the country. Like you do not have like, if I remember, I have participated in some of these massive campaigns, like it was meningitis in most of the African countries where there is the countries in the meningitis belt, where you end up vaccinating almost the old population below 30 years, or like yellow fever, or it depends on the nature of the epidemic of the targeted disease. So I think looking at the nature of how the high-risk population will be identified. The health care workers are being prioritized as one, and then those with the elderly and those with underlying conditions like hypertension, diabetes, and then looking at, so that would be one of the challenges in terms of categorization of understanding the risky groups and how do we approach them. I think someone mentioned that sometimes there has been a resistance from certain groups that why do we have to be targeted? I think what we will see more and more is encouraging the countries, I think, to understand the global guidelines, because the guidelines will be coming out soon and then going to countries like forming different groups. One will be working on the introduction, one looking at the demand issues. But I think what will be really important is to take the COVID vaccine as an integral part of existing immunization programs, rather than because like the challenge which we always see is that some of these strategies comes in separate, like it will be like a separate entity, like even you have the people who are responsible for immunization service delivery not actively involved. So for me, what will be really, really important is to ensure that this becomes an integral part of the immunization program in any given country, and also on a global level. But I think what I've seen now, what is really encouraging is that the same groups which are involved in all the vaccinations at global level, even regional level, they are actively involved into that. Definitely that could be one of the good success factors. And one of the other elements is important involvement of every actor at the beginning, especially the colleagues who are dealing with the addressing issues of vaccine hesitance, demand generation. If they are not actively involved from the beginning, it will be very, very difficult to be convinced. And also another area which is critical is involvement of the NITACs and also the clinicians, because we have seen in other countries, the clinicians, especially the pediatricians and all the physicians, they have been the source of actually creating fear, and then also source of anti-vaccine groups in the countries. It's not like they are lay people. They are people who understand the importance of vaccines, but sometimes for the reasons or any other, we don't know. Maybe there are some other interests. We have seen like they are the ones who have been also the source of creating the resistance to vaccination. So definitely this will be an area which needs to be quite addressed. I think that's what I can respond at this point in time. Thank you very much.
Okay, thank you very much. I think we still have maybe 3 minutes to come to an end of this highly interesting webinar, and we still have too many questions, but we are promising that also some of these questions will be answered and included in our webinar brief for those who are not able to answer. Maybe there is another question regarding because she started with Nito and Daniel, and now maybe for Dr. Kamil about the plans in Jordan to introduce the vaccine and for whom. What's about Jordan in this regard also for the vaccine?
You know that most countries seek to secure their needs of the COVID-19 when it is available. And in Jordan, we are planning to introduce this on time. So His Excellency, the Minister of Health, has made an agreement agreement for understanding with some companies to provide this COVID vaccine when it is available. And it is about more than 2 million doses. And epidemiology committee will define the target group that will receive this vaccine, especially for health care workers.
Thank you. Elizabeth, you have now, I think, too many points, that key messages and takeouts that we want to go from this webinar.
I think the key messages are that you know, we have to lift all boats, all antigens, all vaccines, and we need to promote immunization in general. We need to strengthen routine immunization, and that really is going to help us do the homework needed to build community trust and demand for vaccines. So when a COVID-19 vaccine arrives, communities are ready. I have also heard a lot from different colleagues about the importance of involving diverse stakeholders in this process. And just knowing that building demand is a process, it's not an end state. Just like a marriage, once you're married, that's not when the hard work is over, that's when the hard work starts, you know, and we need to continue engaging with communities and working with health workers to ensure that they have the training and the tools and the resources for them to do their jobs. I think there were multiple questions that came through that were reflecting on the huge workload and expectations of health workers to effectively deal with dropping immunization rates, dealing with health issues in the middle of a pandemic, and then now supposed to be supporting an upcoming new COVID-19 vaccine. That is a lot on the shoulders of not many health workers. And so what can we do to help empower them, encourage them, train them, and ensure that they can be successful? And that's going to require a lot more than just messages and IEC materials. And so I think developing demand interventions really requires understanding your populations and their concerns, understanding what value frames would be most helpful in getting more children immunized, and then building the coalitions that you need to be able to build that trust long term. I don't know, Dr. Majid, is there anything else that you heard that I didn't touch on?
Thank you very much. You captured all the points. I just add maybe one point that regarding that COVID-19 as any crisis also includes hidden opportunities. So there is an opportunity for increasing demand for all vaccines, taking the high demand currently for the COVID-19 vaccine. We need to focus more on coordination and collaboration at different levels, as Daniel said. It's a crucial issue. There is too many fragmentation, unfortunately, and needs now to consolidate our work. You need to documentation of the experience and learning lessons. And I think we are just at the beginning of a long-term journey towards more and more consolidated health system. Thank you very much, dear colleagues, speakers, facilitators, audience. Thank you for your questions. And we hope that we will meet in next webinars, tackling or discussing different key areas. Thank you and good evening, good night. See you. Bye.
Bye-bye.
Thank you. Thank you.